consolidated. And at the end, to make uptake faster and easier, and of course, access to better and more effective treatment options for all our patients also faster. This is our overall goal, and following this goal, we are trying to do our best and would like to present the result of our collective work over the last year. A WHO TB knowledge sharing platform has been conceived to help users of our guidance shift from paper-based documents towards electronic communication more easily. This process has become all the more important during the extreme conditions imposed by the COVID-19 pandemic. It is also aligned to the WHO commitment towards living guidelines, updating recommendations rapidly, as I told, to keep them attuned to the latest evidence. There will be shortly also WHO training modules accessible via the same platform. Over the last week, since the platform has gone online, we have already received feedback. Thank you very much for this. It was very useful. We have taken note of this and are already discussing enhancement for the future. So with this, probably we have very interesting and rich agenda. I will stop, and I am sure that we will hear more today from partners who will connect online. And we are sure that it will be a lively and interactive session, and encourage you all to participate actively. Thank you once again. Over to Denis.
Thank you very much, Dr. Teresa. And well, maybe I can add a little bit more background to the history of this knowledge sharing platform. So it's been really a long journey. And the recent history, I would say, was early last year when we started consolidating our guidelines in a common framework under a modular system with the launch of the TB preventive treatment guidelines in March last year. Following which we have had successive updates to the modular series, and now we have 4 modules that are available, and we will display these later on the system. Of course, there has been also a lot of input in this from my colleagues. So I think I would first start by thanking all the people that have been involved in this, and Dr. Teresa, Matteo in particular, Zignol, who's our unit head, and then also our technical colleagues who have been going through the content which they have developed, and also now looking at it in the new format in the knowledge sharing platform to make sure that it's consistent, that it is in a good format. Since yesterday as well, we have launched the apps. So you can find the apps in the stores, and we will be displaying these now. Alongside the thanks to our colleagues, I would like to thank ADAPT, the agency that is going to present the tools and that has been with us since October, slowly and steadily developing the different tools, giving us different options in order to disseminate our guidelines properly. So the system follows very closely on the modular system of the consolidated guidelines. You will see there are panels with the guidelines themselves, where you can find the guidelines, and you can customize these guidelines as well. They offer now more opportunities than were offered with a simple PDF or even the paper version until not so long ago. And then there is also the another panel which is on the operational handbooks, and these are the practical sort of implementation guides that we have been producing alongside all of the guidelines since last year. Soon to come as well is the training catalog, which will be populated later on this year with 3 of the modular series, and that will provide also other opportunities for training, for e-learning, using a methodology which is very similar to the Open WHO system that people may be familiar with. So I don't want to take too much of the time. I would like to leave more for questions, but before we go there, and before we invite the people who kindly offered to to introduce and to explain how they use their guidelines and what to look for in our guidelines, I would first like to pass to to present David, who will present the desktop application from ADAPT, and followed on by Shruti, who will present also from the side of ADAPT about how to use the mobile apps. So with that, I would like to ask David to take the mic and to give us a tour of the main functionalities of the desktop application.
Thank you very much, Dennis, and thank you everybody else who's joined the meeting today. That's been absolutely delighted to be working with such a wonderful team yet again in the WHO for yet another project. For those who know us, obviously we work with quite a few divisions, but certainly I think over the last 7 months or so with Dennis, it's been a very, very enjoyable experience. So we've been working, as Dennis says, to build the knowledge sharing platform. For those who haven't seen it yet, I hope you are all seeing my screen now and able to see the fruits of our labours. So we had a very clear brief from Dennis and the team, which was to provide a platform which brought in a wide variety of information into one learning point. So as Dennis mentions, we have the consolidated guidelines and the various modules, the operational handbooks, various modules, training catalogues to come. But we wanted to provide a system which allowed people to find information quickly. So there's a quick search function, which I'll show you. And also interlink with the existing information coming from the Evidence Prime with the recommendations as well. I will show you how the platform works as a non-logged in user. So if you were to go to extranet.who.int/TB knowledge, that is the URL, and that is the URL that will you will see once this is fully hosted in WHO. So you're greeted with a nice page to begin with your 3 main sections. As I say, training catalogues, as Dennis mentioned, is to come, but we have the consolidated guidance, the handbooks, some information about us. We have a clear menu across the top as well. So if I come into consolidated guidelines, what I can see are the modular approach and what we refer to as the bookshelf. So this is where all the content for the guidelines is kept. We have various different modules in prevention, screening, diagnosis, treatment. And within each of these, I can click on the front page of the content. And now I've got different options as a viewer. Just to explain the different options, we understand in the world of WHO, people like to read things in a PDF format occasionally and then online at other times. And we've created a system whereby you can do both. The content's only needed to be uploaded once, and it also drives the mobile app. So I'm going to show you the difference between the two. With the PDF viewer, it's a very simple click of a button, and as you would expect, you can view your PDF in normal format. So you could read it exactly as you would expect to. If you just bear with me, exactly as you would expect to, with a PDF viewing up and down for the various different pages within the document. So this will allow you to read in a very familiar format. I'm going to come on to a reason for that in a minute, because we've created something else within the platform. If I want to click for a more web-focused and friendly version, I can come to this view, which is our node view, and I can click on any of these sections. I can open up recommendations, for example. I can look for sections, first line, LPAs, open that up further, click test description, and I can get straight to the text and the information that I desire. So straight away, I'm right into the content. I've got my book navigation here. telling me where I am. So it can tell me here, I've down in the section 3, I'm in test description. If I wish to skip to the next section, I can have a forward and back buttons. So I can justification and evidence, and I can see information here throughout the document. And I have across the top what we call a breadcrumb, which ultimately tells me where in the guidance I am. So I'm in consolidated guidelines, I'm in module 3, diagnosis, recommendations, section 3. So the navigation is very simple within both consolidated guidelines and the operational handbook, exactly the same format again. So I can come in here into any of these, look down, look at one of the modules, and obviously any click-throughs, any links are all accessible. So those are the two bookshelves for the operational handbook, consolidated guidelines. We have a menu across the top for the training catalog. This is going to be coming soon. This is content that is being worked on at the moment, as Dennis said, but it is already provisioned to come in. Then we have the recommendations link, and this is something that you'll be familiar with from Evidence Prime. We have the full functionality within the platform here to look at all of that content as well. So you have your recommendations map and all content. One of the areas that we worked hard on was the quick search function. And we have a number of presets. So these presets, we've worked with Dennis and the team to look at what may be used quite often and also the synonyms around those. So if somebody were looking for content for children, I can click on that and it will bring up a list of the references where child, children, adolescents, etc. Has been found within the documentation. I can then further break that down. I can click onto screening and it's telling me there are 20 odd items within screening with children. And then if I wanted to look at the consolidated guidelines, I could select that. These are the 6 areas where that filter is producing data. So I can click onto one of these and then straight in, it's giving me the information that I require and the links with regards to that quick search. If I go back to quick search, I can also put in any keyword. I can do ANDS. And it will bring up content where weight and children, in that example, are both found in the same category. And as you can see here, obviously I'm looking for weight in children, and so it's provided me dosage information regarding to age and weight. So the quick search function hopefully allows you to navigate quickly to the content within all of the modules. The modules themselves are nice and accessible, and when we come to Shruti, she will show you how this view transposes onto the mobile view. There's one other function I wanted to show you. Everything you've seen at the moment is accessible to anybody who accesses the website. However, we've got a function for people who wish to log in, and if they do wish to log in, which I'm just going to do here, I'm now logged in. I've got a new button at the top and it's called My Resources. When I come to My Resources, I've got bookmarks and I've got customized PDFs. So customized PDFs, I wish to just explain now. So I'm going to come into the consolidated guidelines again. I'm going to take one of the guidelines and I'm looking at the PDF version. Now, I'm interested, there's 68 pages in this PDF, but I may be only interested in pages 20 to 35. So I will just put this in, just so you can see how this creates. bookmark successfully added. I've called it test 2. If I go to my resources and I have a look at the customized PDFs here, I've got here test 2. So I wanted those pages which I've just selected, purely those pages. But I also then want to stitch it together with something which I've seen in module 4 treatment, and maybe something in module 3. So I'm creating my own bespoke PDF. So I shall just call this test 2, submit. And that has now been created. If I wanted to now share that with my colleagues, I've now got a bespoke PDF of content ready to go. I have all the share options, the demonstrations, the printout options, anything that I'd like to do, download this and then share that. So rather than just having all of the content from all of the modules, you can also now very quickly create bespoke content within the platform. So again, it's going to be provisioned for full language translations. That's coming. We're going to have the training catalog that will be coming soon as well. And you have the facilities to access all of the content that Dennis and the team are providing us, hopefully as smoothly as possible. So that really is the demonstration on the platform.
Thank you very much, David. That's an excellent tour. I see a lot of questions coming in as well. We had one question about downloading the PDFs that you have customized. So maybe you can answer that and how that would be organized. Thanks.
Yeah, certainly. So once you have created the PDF, I'm not going to demonstrate it straight away now, but once you have created the PDF, there is a download button that would save to your desktop, and then you can just attach that to an email and then send that obviously to your colleagues. And it sits within the My Resources place.
Thank you, David. Thanks very much. So yeah, so keep putting questions, so maybe I ask now Shruti to share her screen and give us a tour of the mobile app, please.
Thank you, David. I hope you all can see my screen, my mobile. Am I audible?
Yes, Shruti. We see your screen as well.
Thank you.
Thanks.
So the first thing that I'm going to show is, as David mentioned, all the contents that is there on the desktop version of the platform is also available in the mobile app, and we've called it as WHO TB Guide, which is now available in both iOS and Android or the Google Play stores. As soon as you download and open the app, you will be greeted with this splash screen showing the banner and landed into the home screen, what we call it as a home screen. In the home screen, just like the desktop version, we will have 3 tiles: the consolidated guidelines, the operational handbooks, and the training catalog. All the contents that we saw on the desktop are in sync with the mobile app. So there is one place to upload the content, and it is available on both the platforms. One of the first feature that I'm going to show from the mobile app is how the contents can be browsed through. Clicking on the consolidated guidelines, we will see the exact set of modules that are there on the desktop. Once we can choose whatever the module that we would want to browse through. For example, let's say I want to look at the diagnosis. We will be greeted with the table of contents similar to the online version that we saw on the desktop. Accessing any of the content, we will be presented with what is called as a carousel view. You will be able to access all the pages of a PDF similar to the way you access pages in a Kindle. You can swipe left to go to the next section, or you can swipe right to go to the previous sections of the chapters. If you see on the top, this is called as a breadcrumb. which helps the mobile app user to understand where in the app we are browsing the content. For example, we are in the definition sections of diagnosis under consolidated guidelines. Each of these are navigatable. So let's say if I want to switch to a different module, I can click consolidated guidelines and I'm taken back into the consolidated guidelines, list of consolidated guidelines, and then I can swap navigating to any other module. Prevention, for example, has two submodules, the TB preventive treatment and the TB infection control module. We'll be presented with the same list of contents, and we will be able to access, do a quick access from within. The other important feature that we have developed in the app is bookmarks and share. If you see, there are two icons at the top. One is for bookmarks and the other one is the share option. Clicking the bookmark icon marks this page as a bookmark, which you will be able to access using the quick menus at the bottom. I'll come to these sections in a while. And the share option here allows us to share a content using all the social media apps that we have. For example, in my mobile, I have Mail, WhatsApp, Teams, Twitter, anything. So this is possible as long as you're connected to the internet. You'll be able to share the contents around. Coming back to the bottom menus here, the one on the top bottom right is called as a search option. Similar to what we see in the desktop, we will be able to search for any keyword as we type. And you will be able to see a blurb of each of the pages along with the heading. And if you want to navigate further, we will be able to navigate by clicking on the respective page. The next icon in the footer menu is the favorites or the bookmarks. As you can see, I had just marked one of the pages. So this is a quick way of accessing all your bookmarks from within the app as well. I'll be able to quick bookmark as many as I can, and it gets listed out in my quick link of bookmarks. The third button in my footer menu is called as a home button. What this does is it takes us back to the first screen that I showed, which was called as a home screen, which allows us to switch between the three tabs of the app, either consolidated guidelines, operational handbook, or training catalog. Since the training catalog are yet to be onboarded onto the system, we will not have any content to be displayed right now. But as I said, we have a system where you can upload a single in a single platform, and it gets reflected on both mobile as well as desktop. The last menu that we have in the footer menu is the hamburger menu. It's a quick menu to go to all the list of recommendations that we have in the consolidated guidelines, and a quick link to the TPT dosage calculator. If I go to the recommendation sections, it is again modularized. And if I click diagnosis, you will be able to see all the recommendations that are part of the diagnosis module. And by clicking the arrow at the right, you will be able to see through the recommendations guidelines under this section. Now, I would want to demonstrate another tool here, that is the TPT dosage calculator. So this is more like an interactive tool, what we have developed. People who would want to understand the dosage that needs to be administered for the patients, depending on their symptoms. So we can select the necessary regimen and the age here, and we will be presented with the dosage as well as the regimen that needs to be prescribed. This is an interactive tool. So if I have to choose a different medicine, I can, and I'll be presented with the specified dosages. again, depending on the weight for this medicine, will be provided with the respective prescription. There is another menu in the hamburger menu, which is the language. As and when we onboard contents on the platform for different languages that we are going to, in next releases, it will be applicable and will be seen in the app as well. And you will be able to shift or change the languages using this language menu. The most important and proud feature that we would like to call for all the mobile apps that we develop is the offline ability. So mobile app, we will be able to browse through all the sections, all the features, and the contents in the app, even if you don't have any internet connectivity. So we will be able to still get through and read through all the recommendations as and when it is required. So I will not be able to demonstrate this because I'm connected on the internet. So the app will function offline and you will be able to browse through all the contents, even when you're not connected to the internet. Yeah, I think that's it from the mobile side. I'll hand it over to Dennis.
Thank you very much, Shruti. I think that's a really very good demo, and it's nice that we could see as well the algorithm and the dose calculators, because those are, I think, tools that save people having to go through a long algorithm to navigate that through on a small screen. So there is one question from Raj Yadav from Philippines, and he's asking if does this have features like Envivo and Atlas.ti or other qualitative softwares whereby we can highlight as we read and collect the lines in my notebook. And he said Kindle allows this too. If not, can you add the feature soon? Do you,
Yes.
David?
Yeah.
Go ahead, David.
No, I'll let you answer, Shruti.
Yes, so this has been a very important feature that we would like to develop in the next release. We will be providing that feature as well, where we will be able to select a part of content and share. So yes, this is part of our backlog, and hopefully we'll be able to release it in future releases.
Okay, and they're also asking if we can put some information about the apps, the availability of the apps on the desktop application, so that people can go there. And of course, the apps only became available yesterday night, so this had to be but it's one other feature that we will add. There's a number of questions about language versions as well. That's something that also we should be starting to think about. And I think one other feature that will be important, particularly in places where internet is erratic, is also this other desktop instance that we are going to develop later this year, whereby once you go on the website, not on the mobile, of course, the mobile would be available even if you are offline, but on the desktop app, that you will have a version at least that gives you the basic documents in it, even if you are offline, and then as soon as you connect, you can synchronize and update with any new versions that have come out. Okay, so I think that sees us through this session. I'm with Monica and with other colleagues. We're trying to answer as well the Q&A as they come in. So maybe what I can do now is to invite one by one the people who offer to give some of their experiences about the use of the tools. So I know that Siva is online, so maybe we can ask her to join us, and I ask everyone else who will be joining in this part to shortly introduce themselves and where they work, okay, how they use our guidelines, and then also to give some of their impressions about moving away from paper-based or traditional PDF guidelines into use of applications, use of computer content in order to go further, and also to present some of their experience and any questions that they have about trying to look for particular answers to common questions that they have in the field. So yes, Siva, so maybe you can help start the session and with introducing yourself and giving us some of your experience. Please, thanks.
Okay, thank you. Thank you everyone for the opportunity. First of all, I would like to introduce myself. So my name is Siva. I'm from Indonesia. I'm working as a youth activist that particularly focus on public health, which in this case is tuberculosis. Our main work is usually giving the education regarding right of health to the young people and to give more tuberculosis awareness regarding the prevention, how TB control, and how to seek service and seek professional help when they are affected by TB to the young people. And we work with, we take an advantage from digital technology like, social media. And other than that, we make like a short content to like more, we make like the complex things to the more easy learning. So more young people get interested to know about what is tuberculosis, and they could, have interest to take this issue. And I find these guidelines could be very, very useful for us as a consolidated reference platform to learn about TB. And I feel it could be really great to massively, disseminate the guideline and taking more people to the issue and transforming this guideline to be more easy learning content, like, creating live infographics or short digital animation such as stop motion or short video content that we could upload it in a social digital platform like TikTok or YouTube or any digital platform that targeting more young people to gain interest in accessing information regarding TB. And in our country itself, in Indonesia, we also have the called National TB Dashboard, which provide the real-time information regarding the tuberculosis condition, like, the notification, like case notification, death rate, and etc. And we also have the application called Empathy that provide updated information regarding TB, like regarding the guidelines and everything. So in related to that, may I have questions if me or any young people are interested to make this guideline into something that more fun and easy information to be accessed by people? Do you mind to let us know where I could find like a key summary of each guidelines that sum up of the most important things that should be included if we are planning to make a short content about it? Like, if we would like to make a short content, it could be easier if we access, the short summary, that the things that we should be like, the things that should be added in the content. So do you mind to elaborate that things? Thank you. That's for me.
Siva, thank you so very much. I think you've raised a very key issue. So Siva, I mean, just in terms of additional introduction, is part of our WHO 1+1 Youth Initiative as well, which has over 10,000 young people joining. And this is a very important, I think you guys are important champions, not only just the future, but also through innovative mechanisms, as you said, using TikTok, social media, promoting guidance, these guidelines, and promoting people to take it up. So it's going to be really vital. So yeah, look to maybe closer engagement with you, Siva, on the use of the platform as well. So I'd like to invite perhaps Shruti to respond to your question, to show, Shruti, if you could show where Siva and other young people who are connected, where they can access summaries that they can then use as quick blurbs, as quick tweets, maybe on social media. That would be really helpful.
Sure. Hi, Shiva. So
Hi.
What I'm going to show now is if you as soon as you log in and you open the app, you'll be greeted with the module. So I'm going to, let's say I want an abbreviation. So a list of abbreviations is there in the quick menu, and you will be able to use this icon here to share the entire list of contents that is part of this page. And let's say I want to mail it, and you would be greeted with the links to the app if you don't have the app. Otherwise, you would be given the direct link to that page. So I can type in to whoever we want to share, and it kind of sends an email. But obviously, the share application is applicable only when you're online. So this feature has to be done when your app is connected to the internet. We also have ability to put contents which are quick links. For example, here is a quick link to all the recommendations that is part of the consolidated guidelines. So if you want to see anything related to treatment, we can access the treatment and go through all the recommendations here related to the particular topic. Hopefully I've answered your question.
Okay, so all the summary is already included within these applications.
Yes, even in the guidelines, I think there are executive summaries on different modules, which is a quick way to kind of understand. Yeah, the first here. So we will have, we will be able to favorite it, and that way you have an option in the bottom footer menu where you can go ahead and access them. So it's again a quick way of going to the topic that you would want to browse.
Okay, so in short, if we want to make like a short content or anything, this is enough for us to only just for the executive summary, right? This is include everything, right? So we don't need to go through all of the guidelines, because this is we need to usually we need to develop like a short content that maybe we link it to the something that more up to date to today's condition. So to make that thing shorter, we can just read this summary, right? This include everything that
Yeah. So I think, if I may, I think that is it basically. If you want to go to the guidelines themselves, I think the executive summary and the recommendation summary that Shruti has shown, which in the PDF you can find as a table with the executive summary in the modular series of the guidelines, that is probably enough if you want to know what the guidelines are about, right? Then, of course, if you want to implement anything of that, then you'd go into the next one, which is the operational handbooks, and this gives you more how-to sort of advice on how to implement things. Just to remind people, because we're getting these feedback very often about kind of having more accessible documents, right? And documents targeted to the general public, for instance. So the knowledge sharing platform is really a way to disseminate our WHO approved guidelines, evidence-based guidelines, and the associated handbooks. So some of those handbooks already have annexes in them, which have let's say messaging, which can be used during interaction with patients, for instance, counseling. For instance, if you go into the prevention handbook, the first annex of the prevention of the TB preventive treatment handbook would contain these sort of messaging, right? So we already have notions of that, but primarily just to keep in mind that the knowledge sharing platform, it is a way for WHO to disseminate all the guidelines on tuberculosis that are relevant, okay, and that are in one place. This has been a long-standing and well sort of request for WHO to put everything on this in one place. So this is where we're starting from. I think also the training modules, when they come aligned as well and online as well, they will also provide for people who want to have a more sort of instructive way of acquiring the information inside the guidelines, right? And for different type of audiences in the field. We do not have, there is another question here about having sort of a tutorial or a thing to teach. So we have not planned to put help files or things like that, because we thought the process, once people visit this site and get a bit accustomed to visiting once, twice, they will know where to go to find the different pieces. But this may be something that we can consider also in future.
So if I may just add, Siva, to this point. So Shruti showed you where you can find the executive summary. So to give you an example from Twitter, right? You can, from the executive summary, there is the link sign that you can use, of course, to link on Twitter, the executive summary directly to the platform. There is normally a one line explaining what the purpose of the guidelines is in the executive summary. So you could extract that for your, your short tweet. And then you could, do the links to the executive summary, and you could do a Twitter thread with the top 5 recommendations coming out of the guidelines. So to give you an example, I mean, this is something that you could, young people could do the minute a new guidelines comes out, and then you direct people to this more friendly knowledge sharing platform where it's easier to find details compared to a PDF or, like a print document. So having you use social media innovatively, young people like you, that would be really helpful and another way to promote WHO guidelines. So thanks so much, Siva.
Okay, thank you. That's really, really great information for us and really great explanation. So thank you.
Thanks again, Siva. Maybe with that, I would invite, thanks. I would invite Mr. Alan Fabela from the Philippines to join us.
Yeah, thank you, Dr. Dennis, and afternoon from the Philippines to everyone. So I'm a USAID-supported TB advisor embedded at the Department of Health in the Philippines, and my work includes providing day-to-day technical support and advice to the program in terms of implementing the country's strategic plan, as well as developing guidelines for both drug-susceptible and drug-resistant TB treatment. Insofar as the use of the WHO guidelines are concerned, actually last year, in April of 2020, we just released our revised Manual of Procedures, which is a summary of the country's technical guidelines for TB detection, treatment, and prevention. And the WHO guidelines actually form the backbone of our recommendations. Specifically, the newly released guidelines on the TB preventive treatment, as well as drug-resistant TB treatment, including the shorter TB regimens, were included in our MOP, or Manual of Procedures. However, not everything is included in our, or can be covered by our MOP. While it does provide guidelines for majority of patients, there will be, of course, certain cases that where questions would arise. And this is where we turn to the WHO guidelines, specifically the operational handbooks. Just as an example, when we were rolling out the Manual of Procedures and introducing the new guidelines for TB preventive treatment, one of the frequently asked questions was, do we repeat a TPT course for someone who was already given TPT before, but then is re-exposed to another TB case? So there's no specific recommendation in our Manual of Procedures on that. So we had to rely on, or we had to refer them to the operational guideline. And what we do, of course, is we do a search, but this time using mainly the PDF documents. Of course, it's good that our WHO country office would immediately supply us or update us upon the release of these documents, so we are aware that we have them as reference. And then in PDF, we usually use a search function. No? For example, if we encode repeat TPT, several pages would appear. I tried it again a few days ago. I think there were 11 pages in the manual. And from there, we could locate our answers to these questions. Now, when I saw the knowledge platform of WHO, actually, even without going to the specific document, I just used the quick search function immediately without going to the TPT module. And right there and there, you can put your search, and it does give already the pertinent sections across all the different documents. So I think what Dennis was saying about having all these important resources in one location, that to me would be the best advantage of this digital form compared to a paper-based form. And with the digital app version, not only is it available on the web, in your laptop, but you have it in your cell phone and you can access it anytime. So this is a very welcome development for us, those at the level of policy making and guideline development. And more or less, we had a taste of this from last year when the WHO 2020 Global TB Report was released. There was already an app version, and we did find it very useful because you can do a very focused search in terms of finding specific topics. Well, actually, my question is not really a question, but more of a possible suggestion in the future, because I noted that information changes rapidly. We have new information that comes in immediately. And I saw that WHO was quick to disseminate that through what they call the rapid advice document. So maybe this is one consideration, that if there will be changes in these guidelines, maybe a feature that can be considered would be a like something like a push notification for new content or new information for a guideline that is upcoming. So that's it on my side, and congratulations for this very useful platform. Thank you, Dennis. Back to you.
Okay, thank you very much, Alan. I think these are very important, I think, testimonials that you bring, and very, very precious, coming from the field and from someone as experienced as yourself. So I see some other questions coming up as well, and maybe Shruti and David can help answer some of them. So one of them is a request to have a possibility to download content as a Word document, so that people can then insert them more easily or translate them, insert them into the national guidelines, and maybe this is something that can be shown with the customization of the web browser text for use. Maybe we can have a quick look at that one, if that is possible, or else any other sort of solution that you propose.
So yes, thank you. So if I come back, sorry, if you can hear me, hopefully.
Yes.
If I come back into the My Resources and the My Customized PDFs, so as I showed earlier, and I'll take another couple here. So that's three. I'll just take a couple of these and I'll stitch these together to submit. And then underneath I have my curated selections from the PDFs. Now, what I can do here is, from this function, I can simply download it. And if that's still in the browser, you'll see here test tree as a PDF. We have it at PDF at the moment. It's PDF constructor. The idea of having it in a Word document, we'd probably need to take offline and talk to Dennis about with regards to that. But certainly, you know, what you can see here, if I can open up my window, and hopefully you're still seeing this. This is the PDF which I've now created. So we'll try to make, obviously, as accessible and as shareable as possible, and completely understand the reason for the question.
Thanks, David. And maybe while you're there, can you show how to share content from the knowledge sharing platform? Because I think there's another request there.
So here, as I say, when we're sharing from here, what we'll be doing is obviously downloading content to share on. The share function on the mobile app is really simple, because obviously we're able to highlight the content that we're on at that time, and then just simply share the link. But if I'm in any module or any space here, let me take one of the recommendations. You will see across the top, everything that I have there's a specific code to. So if I go to the next page, you'll see the next page comes up. We can quite simply just share that URL with colleagues. If I were to put that in a new browser, they would open up and they would open up onto the same page.
And likewise, printing right from display page or else from the PDF renderer would also be quite easy with the icon that you have on the top with print.
Exactly. Yeah. I can't. Unfortunately, I can't show you how it would print out, but yes, it would be.
David, regarding the login to customize, because this would require a bit of sort of pre-preparation, right? For people to log in at this point in time and get in, be able to customize as you've just done over here. Can you give us maybe a few points on what needs to happen and how things will change in the near future?
Yes, certainly. And thank you, Dennis. And I have seen those questions. So just to let everybody know, at the moment, we are transferring the platform to be hosted within WHO. Once it is hosted, login will be simple. As per most platforms within WHO, two-factor authentication for security is required. Obviously, we do not want any malicious use of any of the websites or any of the platforms that we create. So that would be quite a standard process. If I log out of this, for example, hopefully you can still all see my screen. But if I am just logging out and I try to log back in, I will do it. Actually, I'm going to change browser for this because this was cached for me. Just bear with me 2 seconds. Just going to change my window. Because what we obviously want to ensure is that people are authenticated when they log in. Now, currently, when I try to log in, this is on a different browser. If I'm coming in and I'm using Windows Azure, so basically anyone with a Microsoft account should be logging in. We'll click onto this and we go through this permissioning. At the moment, it's saying an issue occurred with the Azure AD administrator, and they need to click on this button here. This is because it needs to be individually approved as a trusted application, and that is only until WHO hosts this. So within the week, hopefully, or beginning of next week, this won't be an issue. But if you wish to access it now, simply we've provided a link here, and you click on that link, and it will take you through to the Microsoft advice. And this would be for the administrator within your organization simply to approve this application. And if they do it for just one person, if they approve it across the organization, anybody will then be able to access it within the organization. It's just a little step we have to go through until we get to the point of WHO hosting the platform. Hopefully that answers the question.
Thank you very much, David. But the bottom line is that it will change. It will become a bit simpler. Yeah.
It will be seamless as soon as it's in the hosted within WHO. Yeah.
Yeah. Okay. Thank you very much. There are some other questions here about which I also referred to you. It's about the use of conversational AI for passive search and intelligent response, if there is something that is anticipated in the near future. Is this something that that you think could become a feature here on the on the tool?
So again, Dennis, that would be a conversation for us to have for future improvements. Certainly, this is one of many projects that ADAPT deliver to WHO. So we're more than familiar of using AI and machine learning to obviously read and understand and predict what people will be looking for. So yeah, we can obviously talk about that, Dennis, if that is something that people feel will be needed to bring to this platform.
Thank you very much, David. There is another question here about the content of the, so I can answer this. So we used to have a compendium of documents that WHO produced, not just guidelines, but also the report. So I think this will replace part of that feature, and it will only look at the guidelines, handbooks, and training modules. So the compendium included other things, but we will see if that will need to be replaced in future. And again, rapid communications, usually we send them off from a different source, because rapid communications are sort of temporary documents until the definitive guidelines are become available. Okay. So maybe I ask the next speaker to come on. I invite Jojo from Zambia. I believe you're online.
Okay.
Hi.
Good morning, everyone. I'm Jojo from Zambia. I'm based in Lusaka. I work with the University Teaching Hospital, which is the biggest referral hospital in the country. I'm a TB nurse and an HIV practitioner. I work with the TB clinic there. And my work involves notifications. We notify patients who are newly diagnosed. We have an MDR TB outreach within Lusaka district. We follow our patients and meet them at the nearest clinic to their home. We also conduct healthcare worker screenings within the hospital. It's a big hospital with well over 3,000 healthcare workers. So we do this annually. And we also have a TB IC training program. And it's been running for a number of years. We try to sensitize as many healthcare workers on TB infection control. And the use of WHO handbooks, I think the best example for me to give would be there's the WHO policy on TB infection control in healthcare facilities, congregate settings, and households. Our own TB manual, TB infection control manual, has been based on this book. So this has been very handy for me as a TBIC trainer. I regularly use it. And also, I like what Shruti presented on the TPT, dosage calculator, because from time to time, I do work in the HIV clinic as an HIV nurse practitioner. So I tend to put a lot of people on TPT. So I think this tool will be very, very handy. Then what I decided to do yesterday, I consulted fellow nurses from different clinics just to hear their view on this shift to the digital platform. So most of them were actually very excited. Some of the points they gave was that it's to be easy to access. They talked about storage. It was beyond hand, especially the mobile app is the one so many people are so excited about, because even when you're working in our setting, you do not always have your laptop, but your phone is there. And if you need to find out something, it will be very easy. I consulted some colleagues in the rural setting. Their main concern was, of course, on internet, because as you go further into the rural areas, some of the internet reception is very bad. I'd even sent a question about this, and I'm glad that something is being done about it. So this is a very exciting development for us. And I'll also be very interested in the training manuals, especially because of my TBIC. I'm in the forefront at the hospital when it comes to TBIC training, because I think TB infection control is very key in our setting because of the large population and the number of people working in the hospital. And I was also browsing through the platform yesterday, and it's very interesting, especially the screening model. I like the way it is. I was looking at tools for screening TB disease among people living with HIV. And I think it's very well arranged, and I really appreciated it. And I thank you so much.
Thank you very much, Jojo. And yeah, it's good that that you had the time as well to look at some of the functions. So the training modules are expected to come online sometime around maybe September, October this year. We have 3 modules on which there will be training material. So these will be on TB preventive treatment, on treatment of drug-resistant TB, and diagnostics. So these will be the first modules that will be elaborated. If you go to openwho.org, and you can see a little bit the type of content that is available there. It's of course that material covers a lot of other things. Not it's only a little bit on TB at this point in time, but there will be a TB channel there, and it will contain these training modules that we have, as well as other material that is directed for other audiences and is beyond guidelines on the channel. So this is something as well and as soon as that material is available on the OpenWHO.org website, we'll also link it up to the training catalog panel in the application itself. Okay, thank you very much for that, and maybe the next thanks. The next person to ask is Eunice. Maybe she can join us. So Eunice Omesa.
Good afternoon,
Yes.
colleagues. Good morning, everyone. Yes,
Hello.
thank you very much. And hello, my name is Eunice, focal point for TB at the WHO country office. And I'm delighted to have this opportunity to share my insights behind this innovation. But first and foremost, I'd like to congratulate the team behind this innovation. A very welcome initiative, especially in the context within which we are operating. I'll be sharing my insights on the same, and I think as far as this is concerned, we are, at the country level excited because sharing and dissemination of policies and recommendation has now been made easy because we now have a one-stop shop where we can have all the consolidated guidelines and materials shared, as opposed to the past where individual guidelines and guidance was shared at the country level. Again, also with digitization of the guidelines, particularly in this era, will reach a wider audience from the policymakers, program coordinators on the ground, and even going beyond the TB circles, and importantly, the healthcare workers at the service delivery level in what we would term as mobile guidelines, as my colleague has indicated. And knowing too well the spread of mobile phones and applications, now more than ever, we have penetration of network and even remote settings, although it varies across the region, will also go a long way in facilitating knowledge sharing at that level. I think I'm also happy to learn that with these guidelines becomes a bit more practical and applicable, especially in the hospital settings where patients are managed. And at that point, you can make very quick reference and decisions in care and management of patients. For example, as has been highlighted, in calculating dosages for children on TPT, very quickly calculating the bandwidths, and knowing how much drugs to administer to a patient, I think goes a very, very long way, especially when it comes to direct service delivery. Also impressive to see that we can have quick and easy access to information just at the click of a button through navigation functions to the modules. I like that there's a search engine, there's the bookmarks and their favorites, so you can very quickly navigate that aspect and access the information in that regard. And then we certainly look forward to the training module. I think it will go a long way in addressing gaps in knowledge, especially in building capacity amongst the healthcare workers in high burden countries with very limited resources to support in-person training or meetings. Because we have seen in the past, in-person trainings or meetings actually reach fewer care providers. And I believe this platform will expand that scope and reach a wider audience. We'll also have, I think, healthcare workers in a position to provide, specialized care, especially for patients who present with complex cases, which has been a challenge, especially in the context like in a high burden context for TB and HIV and drug-resistant TB. Again, in the COVID-19 pandemic context, I think where we have restrictions with in-person training, sensitization meetings, and so on and so forth, I think this platform will reach a wider audience. And I'm excited, and I know my colleagues are also excited because we can now disseminate these links easily with our colleagues at the service delivery level. We look forward to popularizing this platform for use, and we can't wait for to maximize the benefits and the impact of the platform. That would be it from my end. Perhaps the only question I'd like to ask is if this platform can be linked in national training materials or contexts for reference, for use, for practical use, especially if the guidelines have been adapted in the country. And then the other question is, would it require additional resources in terms of, and I think my colleague has also asked this question, is it a live application that you require data resources to always for access, or is it an application that once you have on your phone or gadget, it stays there until an update is required? Thank you very much. Those are my insights, and I look forward to interacting more with.
Thank you very much, Eunice. Yes, so I think with respect to the questions that you have, so for the applications themselves, if you download them, install them, then they stay there, and if you have background updates, they can update them when you have when there is an update coming up, and you need to and then you have the latest version. I think if I understood well, the first question you have is how to reference, let's say, a document in your guidelines, right? For instance, if you want to say we are going to update the screening policy of my country in Kenya, whatever, how will I refer to the latest guidelines? So if I understood that question well, in that case, you would need to refer to the source document, which is available, so that you make sure that, because that document has ISBN and has a definitive sort of location in as a main document. Of course, one can also refer to the knowledge sharing platform and give some instructions about how people can go and find the particular guidelines and on the particular date that it was accessed. So, but taking maybe from this question, there are a couple of questions here about when you, for instance, customize a PDF, right? And there is a new version which came up again. Do you need to refresh that bookmark, or else will the bookmark, let's say, if on this page there has been a revision to a recommendation or a section, do you need to refresh that bookmark once the update has happened, or will it always be done sort of automatically in the background? And so maybe, David, you can answer the question, thanks.
Yes, certainly. Okay, so currently, yes, you would need to recreate the PDF, because when we're creating a PDF, we are literally we're uploading the pages of the PDF from that previous version. So we are selecting pages 8 to 12, for example, in a bespoke PDF creation. When the new PDF gets uploaded, the 8 to 12 may not be the same pages. There may have been another page that's been included, so you would need to recreate at that stage. However, the frequency of PDFs being created, hopefully that won't be an issue. With regards to content upload as well, when content is uploaded, we've got different types of users within the platform, as you could imagine. We have our typical sort of browsers who wouldn't be logged in. Then we have our authenticated browsers, so people who have logged in. And then you have people like Dennis and the team who will be content admins, who will be able to change and upload content. The way we've created this as well is when the information is uploaded, and what you saw on the platform, there were 2 views. There was the view with the PDF, and then there's a view that we call the node view. When the content is updated in the node view, that automatically changes the content within the mobile app. So it's only been changed at one point in time. And with regards to content being updated onto a mobile app, we're very conscious with all of our projects that we work across countries with very low bandwidth and where data can be quite expensive. So we only ever pass the packet of data which is changed for when the person next accesses the app. If an update is needed, it is purely the small amount of data that has changed at that time.
Thanks, David. And there's another question about color coding of bookmarks so that they get prioritized. Is this an option available? I'm not sure myself.
I saw that. I thought it was a brilliant idea. Yeah, again, Dennis, let's talk if we want to include that and how we can include that. But yes, we've got a number of in-house products where we have color coding for prioritization. So yeah, it's certainly more than possible, and I think it's a great idea.
You're muted, Dennis.
Can I please, with that, invite Dr. Yashoda from India? Can you find him, Lou?
Yeah, good afternoon.
Yes, we hear you. Please go ahead.
Yeah. Good afternoon. I'm Dr. Yashodhara, the District TV Officer working in Mumbai, India. Mumbai being just not the financial capital of the country, but sadly one of the TB capitals also. And we are having lots of challenges here, but we are trying to implement the National TB Elimination Program with a very ambitious goal of TB elimination by the year 2025. So me and my 23 other colleagues under the Municipal Corporation of Greater Mumbai are involved in basically implementing just not the National TB Elimination Program, but also working with different stakeholders across the public and private sectors together. And one of the most crucial parts of our work is keeping ourselves and all the stakeholders abreast with the latest developments and the latest guidelines from WHO and from the national guidelines also. Also, a very crucial part of our work is training and retraining them and getting things done, getting cases notified, providing appropriate patient care right to the logical outcome of the patient. As far as the WHO guidelines are concerned, they form a very
Unfortunately, it's frozen, Dr. Yashodhara. Maybe we can wait a little bit, or you can switch off the video for a moment. Yes, I think we're seeing you again. Can you try your voice, please?
Yeah, sorry.
Yes, we're hearing you now.
Got
Yes.
disconnected. Yeah. So as far as the WHO guidelines are concerned, it forms a very strong backbone of all our national guidelines. And we try to stick to all the national guidelines and the policies as recommended by the WHO as far as possible, may it be the diagnosis part or the treatment or the prophylaxis, anything and everything. My views about going paperless, I think it's a wonderful thing. It has been long awaited for people like me who are working with all the grassroots workers, wherein we are flooded with questions, flooded with many queries, and we have to tell them that we'll get back to you once we refer our documents. We have to come back, we have to refer our books, and then get back to them. But now it will be possible with just, within a minute, there and there only, through our mobile apps, where we will be able to access all the guidelines within a minute and share it with our colleagues and explain it to the relevant staff also. It will be definitely less cumbersome and definitely save a lot of time and energy. Well, I've tried using the platform with the link that was previously provided to me. And I must say that it's really impressive and very user-friendly. Especially the option of, the search option is a boon, wherein we need not go through all the modules. We can just type a word of relevance and get the required information. So it's really nice. With this, I have a question. Though it's not directly related to the platform functions right now, and I understand that it's a knowledge sharing platform, but just like the TPT dosage calculator, I was wondering, could there be a possibility of expansion of use of this platform in future to suggest appropriate regimens to the clinicians once the correct lab results are fed in? Why I'm asking this question is because in our Indian setting, we have long queues of patients and just a single doctor looking at the patients. So that would be really helpful to the clinician to save time and make more informed decisions about the regimen of the patient. So that's my question. And before I end, I really congratulate and I really thank the team for for the launch of this wonderful platform. Thank you very much.
Thank you very much, Dr. Yashodhara. And in answer to your question about the regimens, I think that's a great question. And I think these tools are kind of more helpful to help people go through the successive steps, right, to come up with a regimen. We have put already the dose calculator you can see for TB preventive treatment, for instance, giving you the different options that you can offer to people for treatment of TB infection, and then taking you to the next step of age or weight, and then proposing the regimen. So we can, if you're talking about, for instance, drug-resistant TB treatment, then it will need to be a bit more elaborate, right? Because other conditions come into place to play when you want to make decisions on individual treatment. So we have about 8 minutes left. I would like to invite, we have two persons as well who volunteered to join us. So one is Nizje, she's a nurse from the Netherlands, so maybe I can invite her to intervene, but I would like to have short intervention so that we give time as well to Isan as well to make her intervention. Nizje.
Okay, good morning. Good morning all.
Good morning.
Thank you for the invitation, and I will try to make it shortly. And congratulations for the team for this great initiative. I'm a TB nurse, and I also have a background in nursing education, and I'm working as a TB consultant at KNCV Tuberculosis Foundation in the Netherlands. And as a consultant, I'm involved in different aspects of TB control, and a great amount of my time is for training and education of healthcare workers. And we organize training for nurses, medical assistants working in public health TB care, and a lot of other organizations. Next to that, I'm very much involved in guideline development and the implementation of guidelines. And for guideline development and also for training and education, I think a platform like this can be very beneficial. When guidelines are written or updated, it's very important to have recent evidence available. At the moment, we are developing a nursing guideline for the care for people who are treated for TB or receive preventive therapy. And one of the steps in this process is to know what is already developed, of course. A platform like this, where not only the guidelines, but also the implementation documents are collected, will make this search more easy. And I was also very much impressed by that you can make customized PDFs. And I do have a question about that because it was not quite clear for me how to get the credentials to log in to to have your own personal site for this. As you know, the Netherlands is a low prevalence country, and one of the challenges of a low prevalence setting is to keep the knowledge and the quality of care updated and of high standards, as less healthcare workers are still involved in TB care and treatment. And a good accessible tool like this for implementation documents and training options for a broad public can help in this, I think. And working together is very important because why should we waste time to reinvent the wheel? And I think it's good to share knowledge. A collection of all the available guidance and implementation documents helps us to get a quick overview. And the advantage of digital available materials from my point of view is that they are easily available, everywhere available, and that we can easily make links when we give advice, when we give technical support, or in training and education. And it's also more guaranteed that you have the latest versions, much more than we use paper-based guidelines. And I also have a question about, it was also mentioned by other speakers, if you can give a push when there is updating of guidelines or materials available. Another advantage that I think is that digital guidelines and relevant documents, at least if you edit the relevant search terms, are easy to find, also for professionals for which TB is not their daily business. A very good addition of this new platform for me is also the training packages, which will be coming soon. Since 2019, I'm Program Secretary of the Nurses and Allied Professionals subsection of the Union. And also in this role, I see the need for and the advantage of sharing knowledge. This is since years a topic which has been discussed among nurses worldwide. I think a platform like this can be of added value for this. And this morning I got a link for the mobile app and I searched a little bit through it, and I think this will be a great addition to this sharing wish. And maybe in the future, of course, this is a start, and I think this is a great start. And I was wondering if in the future, if there are plans to edit with guidelines and documents from other global organizations, like my organization, the Union, or the International Council of Nurses. Thank you.
Thank you very much, Nizje, and we'll keep these things in consideration for future versions. So we have 3 minutes. I would like to ask Isan to make her presentation, please.
Thank you. I hope you can hear me.
Yes, we see you as well. Thanks.
All right. So I'm Isan. I'm a primary care physician in for DRTB patients at one of the pioneer treatment initiating centers in Ethiopia, which is Bishoftu Hospital. I'm also a trainer under the National TB Program and a member of the Clinical Review Committee of Oromia Regional Health Bureau. And I noticed that moving to a virtual platform was inevitable as the use of e-devices is rapidly expanding and quick access to data at our fingertips is necessary. And I used to actually download these compiled modules and guidelines from the WHO website for a quick reference. And now that they are available all together compiled, it's easy to navigate through in one platform. I'm very excited about that. I did have some questions for the developers and the experts about how the platform will evolve from now. I mean, what features are planned to be added later on? Will there be visuals, heat maps? I noticed there was a heat map on the recommendations tab, which I really found to be brilliant. But at the same time, there were some recommendations that I highlighted for myself so that I can refer to them later. But I wasn't able to go back and look at my highlights easily. So that's one question I had. The other thing I noticed from the contents, while I was wondering if the platform will be able to fit the different learning styles of people and how you are able to correlate with practical work, this platform. I mean, any expert advice from practical standpoints, will they be available? And about the levels, I was also very surprised with how suitable it was. It's very user-friendly. And I was wondering if, like it was said earlier, we are able to raise interest in audiences by sharing this content like news flashes and alerts and tweets. And I was wondering how we could actually do that and if we could incorporate these sharing bullets and tabs in the platform. And I found the presentation to be simple. The fonts, the choices, the navigation, it's very, overall has a very good interface. And I think most of my colleagues from Africa also mentioned that we are living in a resource limited setup. So even right now I'm having issues with my internet connection. So I'm wondering how we're planning to tackle such issues. And to, I like the fact that it's downloadable, but how about the other issues? Will there be maybe a possibility of updating a lot of information? I don't know. It's just a question that I have. Everything I noticed while skimming through the treatment manual, I was trying to just look at the short-term regimen, navigating through the questions, the segment, and I noticed that there was some redundancy in the content of the manual or the guideline, and I've never noticed that before on printable guidelines, and it gave me a sort of idea that this platform could also be a sort of feedback for manual developers, guideline developers to correct on guideline issues such as this one, errors. And yeah, overall, I really enjoyed it. Thank you very much for giving me this time. I hope we get to join again once the training tabs are launched and also the login options are launched. That's all for me. Thank you.
Thank you very much, Isan. And it's a pity we didn't have much more time to go over these issues that you raised. I think the thing about highlights disappearing, I will check what that is. And also, we didn't have time to go into detail about the recommendation map that Evidence Prime has developed with McMaster team as a separate project, and which is linking up to this, and it was shown very quickly. But that is also another possibility, another potential for it for the site. But thanks very much for these feedbacks, and we'll make sure that we take in all the feedback that we received today. It's of course it's a start, as you said, so things will move. The point about redundancies, that is clear, I think, because very often we have text in the guidelines which is also to be found in the handbook, but we have to conform as well about the content requirements for the time being that are required here for our main documents. So with that, I would like to thank everyone once more for this very interactive and interesting session. It's good that I had the opportunity as well to answer firsthand some of the questions that you had and the excellent suggestions. And I hope that we keep discovering this tool and we keep working together so that we make it more functional and more useful for your work. Thank you very much. David and Shruti, I don't know if you want to say anything at the end.
Yeah, obviously, Dennis and team and colleagues and everybody who's participated today, some really, really interesting feedback, some great points as well. And we'll be obviously delighted to continue working with the team to developing this further and further, bringing in those features such as notifications, as people have said, color coding bookmarks, and all the others. So, you know, big thanks. As I mentioned to Shruti, it's humbling for us to be in a room with such wonderful people. Thank you.
All the time, yes. Thank you everyone for the opportunity, and it's really good. It was a wonderful project to work on, Dennis. Thank you.
Thank you. Bye.
Thank you, everyone. Bye-bye.
Thank you. Bye.
Thank you, everyone.
Bye.
Bye-bye.
Bye-bye.